Pharmacy practice includes all those activities which a pharmacist faces in his professional life. It is therefore essential to watch this video carefully and learn as much as possible. Pharmacy practice refers to the profession and activities associated with the preparation, dispensing, and management of medications and other healthcare products. Pharmacists are highly trained healthcare professionals who play a crucial role in ensuring the safe and effective use of medications by patients. Pharmacy practice consists of a wide range of responsibilities and functions as under. Number 1. Medication dispensing. Pharmacists dispense prescription medications to patients, ensuring they receive the correct drug dose and instructions for use. They also provide counseling on how to take medications safely. Number 2. Medication therapy management. Pharmacists collaborate with healthcare providers to optimize medication therapy for patients. Number 3. Patient counseling. Pharmacists offer information and advice to patients on topics such as medication administration, potential side effects, and how to manage chronic conditions through medication therapy. Number 4. Medication safety. Pharmacists play a vital role in preventing medication errors by verifying prescription accuracy, identifying potential drug interactions, and ensuring appropriate labeling and packaging of medications. Number 5. Compounding. Some pharmacists are trained in compounding, which involves customizing medications for individual patients' needs when commercially available products are not suitable. Number 6. Drug information. Pharmacists provide drug information to healthcare professionals, patients, and the public, helping them make informed decisions about medications and healthcare. Number 7. Immunization. Many pharmacists are authorized to administer vaccines, including access to essential immunization services. Number 8. Medication management in healthcare facilities. Pharmacists working in hospitals and other healthcare facilities are responsible for drug procurement, distribution, and monitoring of medication use within the institution. Number 9. Medication review. Pharmacists conduct medication reviews to identify potential medication-related problems and improve medication therapy for patients, especially those with complex medication regimens. Number 10. Health promotion and disease prevention. Pharmacists may engage in health promotion activities such as smoking cessation, counseling, providing information on preventive measures, and offering screenings for various health conditions. Number 11. Pharmaceutical care. This patient-centered approach to pharmacy practice focuses on optimizing medication therapy to achieve positive health outcomes for individual patients. Number 12. Research and development. Some pharmacists work in research and development roles, contributing to the discovery and development of new medications and therapies. Pharmacists are an integral part of the healthcare team and work collaboratively with physicians, nurses, and other healthcare professionals to improve patient health outcomes and promote public health. At the end, you are requested to like and share this video, and also subscribe my channel Javedan Pharmacist. Thanks a lot.